Yes, now we'll discuss about the wall of the thorax. Here you can see this is wall of thorax. If you cut a section at this level, a small piece of this thoracic wall is removed from here, then you will see this is lung. This is lung. This lung is covered by pleura. This pleura is visceral pleura. This is visceral pleura which covers the surface of the lung. This is visceral pleura. Visceral pleura. Then there is this is parietal pleura, which is adherent with the endothoracic fascia. This fascia is endothoracic fascia. This is endothoracic fascia. So here you can see this is endothoracic fascia. And here is deep to this there is parietal pleura. This is parietal pleura. And there is visceral pleura. There is a lung. In between the parietal pleura and visceral pleura there is space. This is known as pleural space or pleural cavity. Then another layer is this is a rib, and here is here is skin, there is fascia, so this outermost structure is skin. This is skin. Then there is fascia, skin. Then there is superficial fascia. This is superficial fascia. Then there is deep fascia. This is deep fascia. This is deep fascia. Here is rib. This is a rib. This is one rib, and another rib lies here. This is another rib. here are some muscles. Here in this side, there is attachment of muscle. This is serratus anterior muscle. This muscle is serratus anterior. So this is serratus anterior. Serratus anterior muscle. So this muscle is serratus anterior muscle, attached with the rib. This is upper rib, this is lower rib. Between these ribs, there are muscles. External intercostal, here are internal intercostal, and here is transverse thoracis muscle. And here is a vein, artery, and there is nerve. This is three structures: vein, artery, and nerve is present in intercostal space. So between two adjacent ribs, there is a space known as intercostal space. This space is filled with the external intercostal muscle, internal intercostal muscle, and transverse thoracic muscle. Between internal intercostal and transverse thoracic muscle, there is a neurovascular bundle. Relation of the structure in neurovascular bundle: vein uppermost, then artery, then nerve. These are intercostal vein, intercostal artery, and intercostal nerves. So here you can see. So this is arrangement: skin, superficial fascia, deep fascia, then extensive muscle. This serratus anterior muscle. This is extensive muscle of thoracic region. In thoracic region, there are several intrinsic muscles. The muscles of the upper limb, pectoralis major, minor, serratus anterior, and backside, rhomboides major, minor, latissimus dorsi. There are several muscles of the upper limb, and also rectus abdominis, external oblique muscle, and on back side there is erector spinae muscle. So these muscles are muscles of the extensive group of the muscle in thoracic region. And here this intercostal muscle, between two adjacent ribs there is space. This is intercostal space, and here these three groups of the muscle: external intercostal, internal intercostal, and transverse thoracis. Transverse thoracis has three muscles, we will discuss later. So these structures are the intrinsic muscle. So wall of thorax, basically in this region we will discuss about the intrinsic muscles and structures. These are vein, artery, that are intercostal vessels and intercostal muscles. Especially these structures we will discuss. These structures. Deep to this, there is endothoracic fascia, then parietal pleura, then pleural space, then visceral pleura, then there is a lung. So these are relations, these are structures from outer side, from skin to lung. This is the arrangement of the structures in the thoracic region, and we will discuss only this intercostal spaces. If you see in a other two-dimensional diagram, simple diagram, you will find there is skin, outermost structure, then there is superficial fascia, then there is deep fascia, then there is a group of muscles. This muscle may be any muscles of the which is attached to this region. This is muscle, Then there is ribs. And here you will find several muscles. They are external intercostal and internal intercostal and transverse thoracis. Then there is a endothoracic fascia. This is endothoracic fascia. Then there is parietal pleura, which is attached with this. Then there is a visceral pleura. This is visceral pleura. Then there is lung. Here is lung tissue. So this is structure from outer side to inner side in simplest way. In case of pleural effusion, this pleural fluid is collected here, this side. From passing to this side, the needle is inserted, which passes through the lower part of the intercostal space, because in upper part of the space there is vein, artery and nerve. This is neurovascular bundle which lies upper part of the intercostal space. This lower part of space is completely safe. So needle is inserted from here to this part. For the removal of this fluid in case of pleural effusion. So this is clinically important. Here neurovascular bundle are present. If needle is inserted from here in upper part of this intercostal space, then this nerve or vessels may be injured. So this is all about the wall of thorax part 1. This is part 1. Thank you. Yes. Now we'll discuss about the wall of the thorax part 2. In this section, we'll discuss about the muscles of the thoracic region. These are intrinsic muscles of the thoracic region. These are intercostal muscles. These are external intercostal, external intercostal, internal intercostal and transverse thoracis. This transverse thoracis includes 3 muscles: subcastalis, intercostalis, intimae and sternocostalis. First of all, we will discuss about the external intercostal muscle. External intercostal muscle. In this diagram, you can see this is one rib. This is posterior end of the rib. Here is anterior end of the rib. This is level of the angle of the rib. This is angle of the rib. Here is tubercle of the rib. This is costochondral junction. This is costochondral junction. Costochondral junction. This is sternum, and these are the vertebra. This is sternum. These are the vertebra. If you see only 2 ribs, 2 adjacent ribs, this is one rib, This is another rib, just below to upper rib. If you make another rib, this is upper, lower, and for this is upper and this is lower. Between these two adjacent ribs, there is space known as intercostal space. External intercostal muscle. It takes origin from the lower border of upper rib. This is upper rib. This is lower border of the upper rib. This is lower rib. Lower rib has upper border. This upper border has two lips. This is lateral lip, this is lateral lip, and this is medial lip. So these are two lips. So external intercostal muscle takes origin from lower border of upper rib to outer lip of superior border of lower rib. This is outer lip of superior border of lower rib. Direction of the fiber. Fibers directed downward, forward and medially. Downward, forward and medially. This is direction of the muscle fibers. And extension of the muscle fibers. Muscle fiber extend from here up to the, this is tubercle. It extends up to the tubercle. To the costochondral junction, this level, and from costochondral junction to sternum, these muscle fibers are replaced by membrane. So here membrane is present. This is membrane. So external intercostal membrane. This is external intercostal muscle, and here this muscle is replaced by external intercostal membrane. So this is external intercostal membrane. Another muscle, that is internal intercostal muscle. Internal intercostal muscle, if you remove this external intercostal muscle and see the internal intercostal muscle, here we have removed the external intercostal muscle, and now I am seeing the internal intercostal muscle. Internal intercostal muscle takes origin from costal groove. This is costal groove from here, and direction of the fiber is downward, backward and laterally, and is inserted on inner lip. This is inner lip of the upper border of lower rib. So this is inner lip of the upper border of lower rib, and it extends from here. You can see in this, it extends from sternum like this to angle of rib, to the level of angle of rib. From angle to here, this is replaced by membrane, and this membrane is known as internal intercostal membrane. This is, here is internal intercostal muscle, and it is replaced by internal intercostal membrane. So this is membrane. And the muscle is transverse thoracis. This transverse thoracis muscle has three components: subcastalis, intercostalis intimi, and sternocostalis. This subcastalis, it lies at the level of the angle, and especially present in the lower part of the thoracic cage, at the level of the angle. The muscle this is level of the ankle. Muscle takes origin from inner surface of upper rib. This is inner surface of upper rib and inserted on inner surface of lower second or third rib. This is lower third rib, like this. This is a subcostalis muscle. Another muscle, intercostalis intimae. Intercostal intimae, it extends about 2/4 of the intercostal space, middle of the intercostal space. That means from here to here. And it attached on the inner surface of upper rib, takes origin from inner surface of upper rib and inserted on the inner surface of lower rib, like this. It takes origin from inner surface of upper rib and inserted on inner surface of lower rib and extend in the middle 2/4 of the intercostal space. Another muscle is sternocostalis. Sternocostalis, you can see here in this diagram. This is posterior surface, not anterior surface. This is posterior surface. You are seeing from back side, from posterior side of the sternum. This is posterior side of the sternum and the ribs. It takes origin from lower 1/3 of the posterior surface of the sternum, gyphoid process. This is gyphoid process from here to here, and also the costal cartilage. This is 7th costal cartilage. This is 6th costal cartilage, and here is 5th costal cartilage, and sometime there is also 4th costal cartilage here. The muscle fiber takes origin from this side and inserted on. These muscle fibers are inserted on. Here is 2nd costal cartilage. Here is 3rd costal cartilage. 4th, 5th, and also 6th costal cartilage. So these muscles are inserted on 2nd, 3rd, 4th, 5th, and 6th costal cartilage, like this. These muscles helps in the respiratory movements, and nerve supply of these muscles are the intercostal nerves. Here you can see this is external intercostal muscle, and here is internal intercostal muscle. This muscle, if you draw here, it takes origin from costal groove, inner lip, inserted on inner lip. This is internal intercostal muscle, lies deep to external. So here is plane of the vessel. Here is vein. This is vein, intercostal vein. Artery, there is intercostal artery, and there is nerve. This is neurovascular plane for each intercostal space. So each intercostal space is supplied by the intercostal nerve of the particular space and vessels of the particular space. So this is all about the muscles of the intrinsic muscle of the thoracic region. Thank you. Yes. Now we'll discuss about the wall of thorax part 3. In this section we'll discuss intercostal nerves. Here you can see this is there is external intercostal muscle, there is internal intercostal muscle, and here is transverse thoracis or intercostalis intimae muscle, and here is position of vein, intercostal vein, then artery, intercostal artery, and here is nerve, This is nerve. So this is intercostal nerve. There are 11 intercostal spaces. So there are 11 pair of the intercostal nerves. So here in this diagram you can see this is vertebra and here is sternum. This is transverse section, vertebra and sternum. Here is position of this is external intercostal muscle. This is external intercostal muscle, and from here, this is level of the costochondral junction from here to here. This is external intercostal membrane. So this muscle is external intercostal muscle and membrane. So this is membrane and this is external intercostal muscle. This is outermost muscle. This is. Then there is internal intercostal muscle. Here it has membranous part. This is up to the level of angle of the rib. This is internal intercostal membrane. And here is internal intercostal muscle up to the lateral margin of the sternum. Then there is this muscle. This is transverse thoracis, which contains 3 muscles. At the level of the angle, this muscle is subcastalis. This is subcastalis. And the muscle, this is subcastalis. Here is the external intercostal muscle and membrane. Here is internal intercostal muscle and membrane. And this is transverse thoracis. This is subcastalis. And from here to here, middle 2/4 part of the intercostal space, this is intercostalis intimi. This is intercostalis intimi. Intimi. And another muscle which is attached with the sternum, that is this is sternocostalis. This muscle is sternocostalis. This is, here lies spinal cord. This is ventral root, this is dorsal root of the spinal cord. This is nerve, this is spinal nerve. It gives dorsal ramus. This is ventral ramus. This is ventral ramus which passes between second and third layer. That means it passes between the internal intercostal and transverse thoracic muscle here. This is intercostal nerve. It extends up to here, and here it pierces these structures and gives medial and lateral branch. Here it gives lateral cutaneous branch, which again divides into anterior posterior branches. So this is lateral cutaneous branch, this is anterior cutaneous branch. In this course it gives muscular branches, and also it gives branch to, here is endothoracic fascia, which is adherent with this. This is parietal pleura. This is parietal pleura, and this is visceral pleura. So this nerve gives supply to endothoracic fascia and parietal pleura, not the visceral pleura. So it gives supply to these structures. And this is arrangement or plane through which this nerve passes. There are 11 pairs of this nerve for the 11 intercostal spaces. First, second, third, T1, T2, T3, ventral rami of T1, T2, T3 also participates in supplying the upper limb. It gives intercostal brachial, which arises from T3 or T4, and also gives supply to the upper limb through T1. So this gives supply to thoracic region, upper three spaces, intercostal space, and also upper limb. And next, T ventral rami of T4, T5, and T6. These three nerves give only supply to intercostal spaces. So these are typical thoracic nerve. These are the typical thoracic nerve. These nerves are dedicated only to thoracic region. And ventral rami of T7, T8, T9, T10, and T11. These ventral rami give supply to intercostal spaces and also to anterior abdominal wall. It gives supply to the spaces and also anterior abdominal wall. So these are thoraco-abdominal. Thoraco-abdominal. So T1 to T3 also give supply to upper limb. 3, 4, 5, 6 only supply to the thoracic region. These are typical intercostal nerve. T7 to 11 also give supply to the anterior abdominal wall. So these are thoraco-abdominal. This nerve, in case of formation of the pus to here, in vertebral region, the nerve passes through this neurovascular bundle, through this bundle. So pus point may form. This is, here is skin. So this is skin. So pus point is formed here, here, and here. Because pus formed here, follow the route or follow the track of the nerve, follow the path of the nerve, reaches here. So pus point may form here. Through this, it reaches here. Pus point may be formed here, on the lateral side, or here. Pus point may be formed here. So these are the clinical importance of this intercostal nerve. Thank you. Now, we'll discuss about the wall of thorax part 4. In this section, we'll discuss about the artery. In previous lecture, you have seen intercostal nerve. Now we'll discuss about the intercostal artery. This is intercostal artery. As you know, there are 11 intercostal spaces on each side, and each space contains its own intercostal artery. Here, this is transverse section of the thorax. This is thoracic vertebra. This is sternum. Here, this is thoracic aorta. This is descending thoracic aorta. This is thoracic aorta. It gives branches like this, and on this side like this. This gives branch. Here is spinal branch. This is spinal branch. This is dorsal branch. This is spinal branch. Here is dorsal branch. It gives collateral branch. This is collateral branch like this. Here is also collateral branch. Here are lateral branches. The lateral branch. This is collateral branch. And here is position of internal thoracic artery. This is internal thoracic artery. This is posterior intercostal artery. This is posterior intercostal artery. This internal thoracic artery this is internal thoracic artery. It gives these are anterior intercostal artery. Anterior intercostal artery. So in each space on each side there is one posterior intercostal artery and two anterior intercostal artery. The posterior intercostal artery, this is present in all 11 intercostal spaces, and this anterior intercostal artery are present only 9 intercostal spaces, upper 9 intercostal spaces. Lower 10th and 11th space has no anterior intercostal artery. So now we'll discuss about this is thoracic aorta. So we'll discuss about the thoracic aorta which gives the posterior intercostal artery. Here is position of this is thoracic aorta. Here is opening in the diaphragm, aortic opening, and these are the branches. Brachiocephalic, then there is subclavian branch, here is common carotid, there is common carotid, and there is subclavian, left subclavian. So this is left subclavian, this is the right subclavian. This is right subclavian. This is left subclavian. This is arch of aorta. This is descending thoracic aorta. This subclavian artery. This artery is divided into 3 parts by scalenus anterior muscle. We'll discuss later. Here lies scalenus anterior muscle. It divides this artery into 3 parts. This is first part, then second part, and here lies third part. This is scalenus anterior muscle. Scalenus anterior muscle, we will discuss later. So this muscle divides subclavian artery into three parts. This is first, deep to this second, this is lateral to this, there is third part. First part gives costocervical trunk. It gives a trunk known as costocervical trunk. Costocervical trunk. This is costocervical trunk. Costocervical trunk. This costocervical trunk again gives superior intercostal branch. This is superior intercostal branch, which gives to first and second posterior intercostal. This is first and this is second posterior intercostal artery. This third posterior intercostal artery arises from descending aorta. Same way, like right side, same way on left side, this first part of the subclavian artery, it is also divided into three parts by scalenus anterior. This first part gives costocervical trunk. This is costocervical trunk, and this costocervical trunk gives superior intercostal, which gives first and second posterior intercostal artery, and third arises from this descending aorta. This is fourth, this is fifth, sixth, seventh, eighth, ninth, 10th, 11th is subcostal. So these 11 branches, posterior intercostal, arise from this. So first and second arise from the superior intercostal, which is a branch of costocervical trunk, and third, fourth, fifth, sixth, seventh, eighth, ninth, 10th and 11th posterior intercostal, and each side arise from the descending thoracic aorta, like this. So these are the posterior intercostal artery. This is thoracic aorta, and only these two, for first and second space, arise from superior intercostal artery, which is a branch of costocervical trunk. Again, this gives collateral branch here, and here you can see this spinal and dorsal branch, lateral radius branch, and here it anastomoses with the main artery anastomoses with the upper anterior intercostal artery, and its collateral branch anastomoses with this inferior and anterior intercostal artery. So this is all about the artery of the intercostal space, or intercostal artery. Thank you. Now we'll discuss about the wall of thorax, part 5. In part 4, you have seen this is posterior intercostal artery, which arises from the thoracic aorta, and these are the branches of this posterior intercostal artery. Here is internal thoracic artery, which gives anterior intercostal artery. There are two anterior intercostal artery present in the each space. In this diagram, you can see this is first rib, this is first, second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th rib. This is scalenus anterior muscle. This is scalenus anterior muscle. This muscle divides, here you can see, this is subclavian artery, this is subclavian artery. This subclavian artery is divided into three parts, first, second and third part, by scalenus anterior muscle. The first part gives branch it descends downward deep to first costal cartilage, then second, deep to third. This is here. You can see this is first intercostal space, second, third, fourth, fifth, sixth intercostal space. This internal thoracic artery in sixth intercostal space divides into two branches. This is musculophrenic artery and this is superior epigastric artery. This is superior epigastric artery. And this is musculophrenic artery. This artery is here. This is anterior intercostal artery arises from internal thoracic artery. From first to sixth space, it arises from internal thoracic artery. So each space has two arteries. Up to here. In 7th, 8th and 9th intercostal space, this anterior intercostal artery arises from musculophrenic artery. So from here to here, from 7th to 9th space, 7th to 9th intercostal space, anterior intercostal artery arises from musculophrenic artery, and from 1st to 6th intercostal space it arises from the internal thoracic artery. Internal thoracic artery gives another branches also. Here it gives numerous mediastinal branches. From 2nd to 2nd, 3rd and 4th space it gives perforating branch which gives supply to the breast. Here it gives a branch that is pericardiophrenik artery. This is pericardiophrenik artery. So these are numerous branches of the internal thoracic artery, and here you have seen this anterior intercostal artery arises from internal thoracic artery in upper 6 spaces, and then from 7th to 9th space it arises from musculophrenic artery, and below, that means in 10th and 11th space there is no anterior intercostal artery, but posterior intercostal artery in 9th and 10th intercostal space are present. These are the branches of the descending thoracic aorta. So this is all about the wall of thorax part 5. Thank you. Yes. Now discuss about the wall of thorax part 6. In this part, we will discuss about the vein. This is intercostal vein. You have seen this is nerve, this is artery, and this is intercostal vein. In this diagram, you have seen this is thoracic aorta, and these are the branches of the thoracic aorta. For each space, there is azygous vein. Azygous means unpaired vein. This is azygous vein. It accompanies its branch, accompanying the artery like this. And here it receives tributaries along the artery. Here it has one collateral tributary like this. There is cutaneous tributary. Here is internal thoracic vein. This is internal thoracic vein. There may be two vena cabitans of the internal thoracic artery in the lower part and in the upper part, both join to form single trunk. So this is internal thoracic vein. So each space has two anterior intercostal vein. So here is posterior intercostal vein. This is anterior intercostal vein. Posterior intercostal vein on the right side. It may drain into the agilis vein mostly, and on left side it drains into hemiagilis and accessory hemiagilis, and also in the brachiocephalic vein. So we will discuss about the posterior intercostal vein. First of all, this is agilis vein, this is hemiagilis vein. On left side, this is hemi or accessory hemiagilis vein. So in this diagram, this is right and this is left brachiocephalic vein. This is right and this is left brachiocephalic vein. This is superior vena cava. Superior vena cava. This is inferior vena cava. This is left renal vein. This is right renal vein. This is left renal vein. There is a right renal vein. One vein opens here into the inferior vena cava. This vein is lumbar agilis. This is lumbar agilis, and one vein, this is right and left common iliac vein, and here is ascending lumbar vein. So this is ascending lumbar vein. This vein is ascending lumbar vein. And this vein is lumbar agilis. This is lumbar agilis. This is ascending lumbar. And here is another vein, that is subcostal vein. This is another vein is subcostal vein. So all three vein joins form the agilis vein. This is agilis vein, which opens into superior vena cava. So this is agilis vein which opens into the superior vena cava, and this agilis vein is formed by three veins. This is ascending lumbar, lumbar agilis, and subcostal vein. Here, first space vein, that is first posterior intercostal vein, drains into, on right side, it drains into, first drains into right brachiocephalic vein. On left side, first drains into left brachiocephalic vein. On the right side, second, third, fourth. Second, third, fourth joins with each other and form the superior intercostal vein, which drains into the agilis vein. On left side, second, third, and fourth join to form superior intercostal and drains into left brachiocephalic vein. Fifth, sixth, seventh, eighth posterior intercostal vein drains into agilis vein on right side. And on left side, fifth, sixth, seventh, eighth, these veins drains into accessory hemiagilis vein. This is accessory hemiagilis vein, which ultimately drains into aegis vein on right side. So this is accessory hemiaegis vein. Here is 9th, 10th and 11th posterior intercostal vein, and here on left side this is left ascending lumbar. Here is lumbar aegis. On left side lumbar aegis is tributary of left renal vein. This is lumbar aegis, and here is subcostal on left side. These three joints to form this is hemiaegis, which receives 9th, 10th and 11th posterior intercostal vein, and which ultimately drains into aegis vein. So in this diagram, this is 5th, 6th, 7th, 8th. 6th, 7th, 8th. This is accessory hemiaegis. Which drains 5th, 6th, 7th, 8th, and this is hemiaegis which drains 9th, 10th and 11th, and both these ultimately drains into aegis vein, and aegis vein drains into the superior vena cava. This venous system is important in case of the obstruction of the vein. If superior vena cava is obstructed, then blood from upper extremity and head neck passes here. From here it passes through aegis vein into the inferior vena cava. Then through inferior vena cava is reached the heart. In case of obstruction of the inferior vena cava, another condition, the blood from here it reaches through this aegis vein into the superior vena cava, then into the right atrium. So in case of obstruction, this channel provides alternative pathway for blood circulation. So this is venous system. This is these are posterior intercostal veins which drains into the aegis vein, hemiaegis vein, accessory hemiaegis vein, and right and left brachiocephalic veins. Thank you. Now we discuss about the wall of thorax part 7. In previous lectures you have seen the intercostal spaces are supplied by the artery. This is the posterior intercostal artery and anterior intercostal artery. These arteries arise from the thoracic aorta in 3rd to 11th spaces, and anterior intercostal artery arise from 1st to 6th space from internal thoracic artery, and from 7th to 9th space arise from musculophrenic artery. Same way, there is a venous drainage. Here is aegis vein, and on this side there is hemiaegis vein. This vein accompanying the artery like this. These are the same named tributaries like this. These venous tributaries accompanied with the artery. These are the tributaries which accompany with the artery. And here, this is internal thoracic artery. Here is internal thoracic vein. which accompanying with the artery. And here is anterior intercostal vein, anterior intercostal vein, which drains into this internal thoracic vein. This is internal thoracic vein. This internal thoracic vein, here you can see this is superior epigastric vein. Here is musculophrenic vein. Here joined to form internal thoracic vein. This is internal thoracic vein, like this. Here internal thoracic vein drains into brachiocephalic vein. Here is brachiocephalic vein. Here is position of brachiocephalic vein. So it drains into brachiocephalic vein. Internal thoracic vein accompanying the artery and drains into internal thoracic vein here. Sorry, it drains into brachiocephalic vein. This vein is brachiocephalic vein. Tributaries here in each intercostal spaces, like artery branches, there are two anterior intercostal vein, in upper 6 spaces. Then 7th to 9th space, these two anterior intercostal vein drains into musculophrenic vein. This is musculophrenic vein. Here is superior epigastric vein. This is also, here is pericardiophrentic vein, which accompanies the artery. So this is venous drainage of the thoracic wall. Each intercostal space drained by posterior intercostal vein and anterior intercostal vein. Posterior intercostal vein on right side drains into hemiagus vein mostly, and on left side it drains into hemiagus and accessory hemiagus vein. And in upper part it drains into brachiocephalic vein. Here also in first intercostal space drains into brachiocephalic vein on right side. And this is anterior intercostal vein, drains into the internal thoracic vein in upper 6th intercostal space, and 7th to 9th musculophrenic vein. So this is all about the wall of thorax. Thank you.